welcome to 20 for 20. My name is Kathleen Draper with the Elks National Foundation. Today, I'm joined by Iemaan Rana, a 2013 Most Valuable Student Scholar from Illinois. Iemaan received a 2020 Gunther and Lee Weigel Medical School Scholarship, which is offered exclusively to Elks scholars pursuing medical degrees. Thanks so much for joining us today, Iemaan.
Thank you so much for having me.
Yeah, and first of all, I'd just like for you to tell us where you're from and a little bit more about yourself.
Yeah, absolutely. So I grew up in Chicago, specifically in Rogers Park. I spent most of my life there, and I moved to Berkeley, California for undergrad. And I ended up actually just staying for my master's. And most recently, I started my PhD there as well. So yeah.
Yeah, so you might have been familiar because the headquarters of the Elks and the foundation are in Chicago and Lincoln Park. So you probably are familiar with that area. And Rogers Park is not too far from where I am based in Chicago. So it's great that you grew up so close to the Elks, and we're sponsored by a lodge that a lot of our staff are a member of, actually. So you graduated from Berkeley and you did your master's there, and now you're in med school. So what did you study for your undergrad, and then what was your master's in?
Yeah, so my undergrad was in molecular and cell biology with an emphasis in neurobio. So I basically had the background in sort of the hard sciences, the basic sciences, but that really ignited a curiosity in more of an applied science. So I was very curious about how can we take this basic science knowledge and translate it to something meaningful in terms of people's health, which is why I approached my master's in toxicology. And that was really just bridging the interest between, going from fundamental basic science to how people actually get sick. And then, that actually very smoothly translated into the medical degree, where we can try and understand how people get better.
That's really cool. And so you're attending med school at Berkeley, correct?
So I'm actually in med school at the University of Illinois, and
Okay.
I'm concurrently pursuing a PhD at Berkeley.
Wow, that's awesome. So what are you kind of specializing in for med school? Do you kind of have an idea of what you'd like to specialize in yet, or what direction you'd like to go in?
So we barely started. I
Yeah.
think the door is wide open in terms of specialties. I'm still trying to see what I like and what I'm interested in. So far, it seems like ear, nose, and throat, otolaryngology, is most interesting to me. But we'll see. I mean, I can easily see myself going into pediatrics or neurology. So I'm just still trying to explore that space.
Yeah, you're only in your first semester, so you have a lot of time to figure out exactly what you'd like to do. And what's that been like balancing your PhD with med school and kind of pursuing that?
So it's been honestly a wild ride, but so rewarding. I'm super grateful to my PIs at Berkeley, who have been extremely supportive in making this possible for me. I think juggling two full-time course loads is definitely challenging, but also they go hand in hand in such a beautiful way. So I feel like in med school, we sit down, we really drill down on all of the basics of really how the body works, how we approach different types of diseases. And then when I am doing my PhD coursework and my research, I get to put on a different hat. I get to come up with my own problems and really apply those skills in trying to solve them. So it's two different parts of my brain, and it's just honestly so rewarding being able to do both of them.
Yeah, it sounds like it. And it sounds like your PhD program was already kind of established to be more virtual and remote, right? Before the pandemic even began and kind of forced us all into that way.
Oh yeah, well, this is pretty unprecedented, I want to say. I think the even being able to do both of them or getting both administrations on board was really, this was kind of a perfect storm with having everything be online, having all of my research actually be computational, such that I can complete it remotely from Illinois. So just all of those different factors playing together. Also the fact that I've been with my lab for like 6-7 years now. So we have like that good relationship, we have that trust going on. And yeah, I mean, I've just been super fortunate that I was given this opportunity, and I'm really just trying to make the most of it, and run with it.
Yeah, that's really exciting that you were able to make that happen. And your med school classes have been mostly online right now, right? Because you're not doing much practical experience, hands-on work with that yet, correct?
Oh yeah, absolutely. So we've been totally online so far. Hopefully we'll be in person starting from the first week of January. Really looking forward to meeting my online friends in person. And we've had our clinical skills classes online too. So trying to learn physical exam skills on myself has been challenging, to
Yeah,
say the least.
I
But
can
yeah, no,
I can only imagine.
oh yeah.
When did you
But
realize you wanted to pursue a medical degree and that you wanted to work as a doctor or physician when you grew up, kind of?
so for me, this has been um, definitely an evolution. Like I was always interested in medicine. My parents are both physicians by training. So I think I sort of grew up around medicine, and I always had this idea that, okay, this is a career in which you can help people. But as I got older, I became very interested in journalism. So I worked with the Chicago Tribune and National Public Radio, and I really thought, okay, well, I'm going to be a reporter because this is something that that interests me and that I'm talented in. But I realized that the part of reporting that was most interesting to me was being able to tell people stories and advocate for them. And as I sort of collected all of these different experiences, working in nonprofit, and that's something I know you had mentioned a little earlier about Tea House, working with the reporting and newspaper group. I realized that the thing that's most important to me is really just being able to tell people stories and try and lift them up and give them a voice in society. And that's where my interest in science came into play. That's when I realized, hey, I can really take these passions that I have and I can put them together into something really beautiful. And that's medicine for me.
Yeah, that's really awesome. My background is in journalism as well. I did my master's in journalism, and that's definitely what you said about being able to give a voice to others and kind of be an advocate through that is something that I really value, especially in a communications role. It's really awesome to be able to tell other people's stories and something that really excites me too. You kind of answered my next question a little bit. About how your love of storytelling intersects with your career as a doctor, but how do you hope to affect change as a physician, and how does your love for storytelling kind of go hand in hand with that?
Yeah, definitely. I think being a physician is a huge privilege. It's, you know, I come from Rogers Park. I sort of grew up around working class families, and I'm probably one of the only people in that neighborhood or in that community who, went on to go on to med school. And there were so many people that were involved in this journey. And when I think back to the people that I want to help in my career as a physician, I really do think back to those roots. And as a physician, I think that you wear a lot of hats. You wear a hat of a scientist, of course, of a healer, but also that of a teacher, of a mentor, of someone who is advocating for others. So I think that my goal as a physician is to really be able to reach people, to listen to their stories, and to empower them to be able to live their healthiest lives possible.
Mhm.
And that's really what my main motivation for going into medicine was. And that's really where I see myself in 10 years is reaching those people that motivated me to go into this career in the first place, and also being able to try and elevate them into the next phase of their life.
Yeah, that's amazing. And something that really ties into that is the idea an act of service. And that's obviously super important to all of our Elks scholars. That's a big tenet
Mhm.
of the program. So, what types of service have you been engaged in as a medical student and even before that while you were doing your master's?
Yeah, absolutely. So I have been involved in a free clinic called the Street Level Health Program in East Oakland. And we worked with, I want to say, primarily non English speaking patients. And we really tried to um, engage this community and give them the resources that they needed to, access healthcare. So these were primarily folks who did not have health insurance, who didn't speak English, who had no means for accessing medications. So working in this really challenging environment, I felt like it really gave me like the chops I needed to to be able to affect change in difficult situations. I realized that, to be a physician and to be an effective healthcare provider, you don't need fancy equipment. You don't need, you know, um, all of, and of course, there are limitations. Um, but I did realize that there is a lot of power in just wanting to help, simply just giving people a platform to share their stories, and connecting them to others in the community that also offer various services that can help elevate them. So I think being a part of the Street Level Health Project was a huge part, or it played a huge role in my commitment to becoming a physician, and really the type of physician that I foresee myself in the future. Um, I've been away from the school, so I was actually in California for the first semester, but I know that they have other free clinic opportunities in Illinois that I hope to pursue once I move there very soon. But these are pretty I think at least the free clinic that I worked in was a very formative experience for me, and it's definitely something I hold close to my heart as I move forward and I try to decide, what are different spaces that I'd like to practice.
Yeah, it sounds like it was a really important and, like you said, formative experience to help you figure out the direction that you'd like to go in and to really engage with service in a new level, essentially, especially as a med student. And of course, like you've mentioned, you're passionate about a lot of things, but what's something you're passionate about outside of service and your academics?
I really love to cook. That's that is something that I've been. I mean, I think with their life is going to be busy, right? You have time for PhD, MD, running around, doing all your classes. But I do think that self-care is super important.
Mhm.
I love cooking for people in my family, trying different recipes that were passed on by my grandmother, and by my parents. And I also just feel like it brings people together. So I enjoy spending time with my friends, and really just, you know, like I feel like I don't get a lot of that time. So I try to make the most of it when I do get it.
Yeah, and cooking really forces you to slow down and focus on just one thing and take your time and enjoy it. And then you get something to enjoy out of it. I am not much of a cook, but like you mentioned with your family and family recipes, my aunt made me a giant cookbook of family recipes that I hope to cook through in the new year. That's my resolution. So maybe that'll be a hobby of mine like yours.
That's so
But
sweet.
yeah, that's a great way to kind of decompress though after everything you're doing with school is just take time and slow things down. And what is your Weigel scholarship allowing you to do?
um, a lot actually. This. So I had a cross country move. I was going from California to Illinois, basically packing up my entire life, and starting fresh. And um, the scholarship that I received was able to offset a lot of those costs, and a lot of the costs associated with just receiving basic medical training. We were given like this giant list of, here's what you need. You need a stethoscope, you need, all of this equipment before you even start. So there definitely is a very high barrier to entry with as far as medicine is concerned. So I was really grateful that I had that funding to be able to make all of those things happen for me.
Yeah. And if you could say anything to the Elks, what would you say?
I would say that I am so grateful for this opportunity and that this is something that I really carry with me. When I move forward, I think about, I think about all of the folks who have supported me, and the Elks Foundation is right up there with um, just being there for me since day one, right? So since the first day that I started undergrad at Berkeley, I came in with the most valuable student scholarship, um, and all the way, like, this is what, 7 years later that I'm starting medical school, and they're still up there, supporting me every step of the way. And I feel really proud to be part of an organization that is so devoted to service, to helping folks that are in need, and also just so committed to, lifting up the community. That's definitely a value that I share with them. And that's something that I will continue on with in my career, as a physician and also as a member of the Elks family.
Well, thank you so much. And thanks so much for joining us today, Iemaan. And thank you to all of our viewers for tuning in. If you like the show, hit the like button below and be sure to subscribe to our YouTube channel. See you next time. Bye.